When you're raising goats, there's one thing that can take any breeder by surprise: complications during birth. Do you know how to handle them? The truth is, even experienced goat owners can face scary situations. But don't worry. By understanding the most common birth complications, you'll be ready to act fast and with confidence. Stick around to learn how to handle these situations like a true pro and keep your goats healthy and happy. Let's dive in. Number 1. Dystocia. When the kid won't come out. Dystocia is one of the most common and serious complications during goat birth. It occurs when the kid is unable to pass through the birth canal due to incorrect positioning, an oversized kid, or a narrow birth canal. This results in a stalled labor where the doe struggles to deliver without progress, which can be dangerous for both the doe and the kid. Signs of dystocia include continuous straining without visible progress, excessive bleeding, or the doe showing signs of extreme distress. If the doe has been in labor for more than an hour without giving birth, or if you notice any abnormal positioning, immediate intervention is necessary. To handle dystocia, you'll need to check the doe's position. Wash your hands thoroughly and wear gloves before gently feeling the birth canal to determine the kid's position. If the kid is positioned incorrectly, such as in a breech position, rear first, gently reposition it to face the birth canal. If the kid is too large or stuck, mechanical assistance like a puller may be needed. In extreme cases, you may need to call a vet for help. Prevention is possible by ensuring your doe is in good health, not overweight, and well-nourished during pregnancy. Regular checkups during the final stages of pregnancy can help spot any potential issues before labor begins. Always be prepared to act swiftly to reduce risks to the doe and her kid. Number 2. Prolapsed uterus. A scary situation. A prolapsed uterus is one of the most alarming birth complications and happens when the uterus turns inside out and protrudes from the doe's body. This usually occurs after a difficult or prolonged birth when the doe strains excessively, causing the uterus to be pushed out. If not handled promptly, a prolapsed uterus can lead to severe infection, shock, and even death for the doe. Signs of a prolapsed uterus include the appearance of a large mass, often pink or red in color, hanging from the doe's rear end. This is a medical emergency that requires immediate attention. The doe may show signs of distress, such as restlessness, pain, or a sudden drop in appetite. If left untreated, the prolapsed tissue can become infected, making the situation even more critical. What to do? If you notice a prolapsed uterus, it's essential to act quickly but carefully. First, keep the doe calm and in a clean, quiet area. Wash your hands thoroughly and lubricate the exposed tissue with a safe, non-toxic lubricant. Gently push the uterus back inside the body, taking care not to cause further damage. After repositioning, you may need to secure the uterus in place with sutures or a harness to keep it from prolapsing again. If this isn't possible, seek immediate veterinary help. Prevention. To reduce the risk of prolapse, ensure your doe is healthy, not overweight, and receiving proper nutrition during pregnancy. Avoid overbreeding and reduce stress during labor. Number 3. Breech birth. Kid coming the wrong way. A breech birth occurs when the kid is in the wrong position, with its rear end or legs presented first rather than its head. This can create a life-threatening situation, as the doe may struggle to deliver the kid without assistance. A breech birth increases the chances of the kid becoming stuck in the birth canal, which can lead to suffocation or injury. Signs of a breech birth include the appearance of the kid's hind legs or bottom first instead of the head. If you see this, the kid is likely stuck, and the doe may strain but make no progress. What to do? If you notice a breech presentation, take action quickly. First, clean your hands and lubricate the area. If the hind legs are visible, gently pull one leg at a time to help guide the kid out. If the head is stuck, gently reposition it to ensure the kid's head is facing forward. If you are unable to help, a vet may need to assist or perform a C-section. After the kid is born, ensure that it starts breathing and is stimulated properly. Prevention. Breech births are difficult to predict and can happen naturally. However, keeping your DO in good physical condition, providing proper prenatal care, and ensuring she is not overly stressed can help reduce the likelihood of a breech birth. Number 4. Weak kid syndrome. Struggling to stand. Weak kid syndrome refers to newborn kids that are lethargic and struggle to stand, walk, or nurse after birth. This condition often results from difficult births, malnutrition, or infections. Weak kids have a lower chance of survival if not treated quickly and carefully. Without early intervention, they may not get the nutrition they need to thrive, which can lead to their demise. Signs of weak kid syndrome include a lack of interest in nursing, difficulty standing, or being extremely lethargic. The kid may also appear cold to the touch because it has difficulty regulating its body temperature. This condition is alarming, as weak kids require immediate care to survive. What to do? Start by warming the kid. Wrap it in a clean towel and place it in a warm, safe space. If the kid isn't nursing on its own, feed it with a bottle of goat milk replacer. Keep the kid hydrated by offering an electrolyte solution or sugar water if needed. If the kid doesn't improve after a few hours, it might require additional veterinary care. Prevention. To reduce the chances of weak kid syndrome, make sure the doe is in optimal health during pregnancy. Proper nutrition, a stress-free environment, and prenatal care all help reduce the risks. Ensuring that kids are born in a clean and warm environment is also key to their health and survival. Number 5. Retained placenta. Trouble after birth. A retained placenta is a serious issue that happens when the placenta fails to detach from the doe's uterus after birth. Normally, the placenta should be expelled within a few hours, but if it stays inside, it can cause infection, internal damage, and even death if left untreated. This condition often results from a prolonged or difficult labor or from the doe's poor physical condition during pregnancy. Signs of a retained placenta include the placenta not being expelled after 12 hours, along with signs of discomfort such as lethargy, lack of appetite, or a fever. You may also notice a foul odor coming from the doe, indicating infection. What to do? If the placenta hasn't passed within 12 hours, wash your hands and check if it's visible. Never pull on it, as that can damage the uterus. Instead, monitor the doe for infection and discomfort. If the placenta doesn't come out on its own, you may need veterinary assistance. A vet will likely administer medication to help the uterus expel the placenta or may need to remove it manually. Prevention. To reduce the chances of a retained placenta, ensure your DO is healthy and properly nourished before and during pregnancy. Avoid overbreeding and try to reduce stress during labor. After birth, monitor the doe closely for signs of complications and be ready to act quickly if needed. Goat birth complications can be overwhelming, but with the right knowledge, you can handle them like a pro. Whether it's dystocia, a prolapsed uterus, or weak kid syndrome, being prepared is key. Remember, always stay calm and act quickly to ensure the health and safety of both your doe and her kids. If you found this video helpful, don't forget to like, share, and subscribe for more useful tips on goat care. Thanks for watching. Until next time, happy farming.